Everyone, and welcome to this video lecture series on ankle joint complex and its fractures. So in this first video I'm going to talk about the basic biomechanics of the ankle joint complex. So ankle joint basically is composed of three major joints. So we have a tibio-talar joint, also known as the talocrural joint. We have the subtalar joint, which is also known as the talocalcaneal joint. We have the transverse tarsal joint, which is also known as the Chopard joint, basically composed of talus, calcaneum and naviculus, also known as the talocalcaneonavicular joint. Now talking about the movements which are permitted at these joints. Tibio-talar, it's basically plantar and dorsiflexion. Inversion and eversion movements are limited by the lower ends of the tibia and fibula forming a bracket-like ankle mortise, okay, into which the talus is snugly fitted. Okay, then please also remember that the talus is the most widest anteriorly. So in dorsiflexion, this joint is the most stable because there's maximum contact between the tibial and the talar articular surfaces. Moving on, we also have, just remember, medial collateral ligament, which is also known as the deltoid ligament, and its major function is it is key to resisting excessive eversion and prevents valgus stresses, since it stretches and therefore contracts on eversion. Okay, so we already know that all the muscles have an inherent stretch reflex. Whenever it's stretched, it contracts. Okay, don't worry about inversion, I'll be telling you. Lateral collateral ligament, this is the one which is responsible for reducing the inversion of the joint, limiting various stresses and reduces the rotation. Okay, now talking about the basic leg muscles that we have. So we have leg is divided into three compartments: anterior, posterior and lateral. Within the anterior compartment you have the tibialis anterior and the extensor hallucis longus, which is responsible for, both of which are responsible for inversion and dorsiflexion. Extensor digitorum longus is responsible for dorsiflexion and peroneus tertius is responsible for eversion and dorsiflexion. Within the lateral compartment you have the peroneus longus and brevis for eversion and plantarflexion. In the posterior compartment you have the superficial and deep muscles, so the gastrocnemius soleus and plantaris, all responsible for plantarflexion, and tibialis posterior, flexor digitorum longus and flexor hallucis longus, all are plantar flexors and inverters of the foot. Moving on, let's see the primary movements that are permitted at the ankle joint. So we have something called as an abduction and an adduction movement. Okay, we have something called as inversion and eversion and dorsiflexion and plantarflexion. So these are the basic movements which are permitted. So what happens is, in inversion, imagine this to be the right foot, this being the greater toe side, this being the lesser toe side. So greater toe is on the medial aspect, this is on the lateral aspect. You lift the medial aspect of the foot, that's the inversion movement. You lift the lateral aspect of the foot, that's the eversion movement. Now as you can see, when you invert, okay, your foot actually slightly undergoes medial translation. That is, it moves like this towards the medial side. Okay, so that's why they often refer to inversion as an adduction movement, because there has been a horizontal displacement from lateral to the medial side, so it's an adduction movement. Next, similarly for eversion, as you can see, when we try to evert the foot slightly, okay, the foot slightly translates laterally, so that's an abduction movement. Talking about the dorsiflexion, if you lift the forefoot upwards, then that's the dorsiflexion. If you flex the forefoot downwards, then that is a plantarflexion. Okay, so that's all the movements that you need to know. Now also talking about compound movements. So what happens is, when you combine all these movements, like for example we have two compound movements, the supination and pronation. Please remember that both of them occur at the subtalar and the tibio-talar joints predominantly, and both of these positions, that is supination and pronation, they define the position of the plantar surface of the foot. So the plantar is the sole, that is the inferior surface of the foot, and this that you're seeing under the camera is nothing but the dorsum of the foot. So in supination, what will happen is, first of all, there's going to be plantarflexion, inversion, and adduction. So plantarflexion, inversion, and adduction. Okay, plantarflexion, inversion, and adduction. So that's a supination movement. And just opposite to that, you have the pronation movement, which is dorsiflexion, eversion, and abduction. Okay, please remember, in supination, your sole is facing medially, and in pronation, your sole is facing laterally. Okay, so pronation causes the sole facing laterally, supination causes the sole to face medially. Okay, now this is again the same thing. What happens is, when you try to invert the foot, if the foot displaces from A to B, from lateral to medial, if there's medial translation, then that's an adduction movement at the ankle.